So, yep, I think we're live. So, hi everyone, I'm Dr. Sheela Nambiar. I'm an obstetrician gynecologist and a lifestyle medicine physician. And we're here live on the TFL page on Facebook and on Zoom. And I'm really excited today to be talking to a colleague and a very dear friend, a namesake, Mrs. Sheela Krishnaswamy. Just to introduce Sheela, Sheela is a registered dietitian with 37 years of professional experience in the clinical, corporate, and communication spaces in Pan-India. She was trained in India and overseas, and she's active in national and international diabetic associations. She's had a media presence for the last 24 years. She was the national president of the Indian Dietetic Association from 2015 to 18, and she was also on the board of directors of the International Confederation of the Dietetic Associations, ICDA, for 8 years. Formerly, she has been a nutrition entrepreneur, an editor, a public speaker, and a blogger. And currently, she's a nutrition and wellness consultant and works independently as an advisor and writer, an anchor, a corporate trainer, and a counselor. She started Nutrition Nectar, an online series on food, nutrition, and health on YouTube a few months ago. Sheela, I've known for the last 2 years, and I've had the privilege and pleasure of working with her in the Indian Society of Lifestyle Medicine, where she's on the advisory board. I'm really thrilled to have you on board, Sheela. Welcome. And
thank you so much, Sheela. Thank you for having me here, and it's a lovely opportunity. Thank you for that.
Most welcome. It's my privilege. So we'll start, Sheela, with a couple of questions that I've always wanted to ask dietitians. So my first question, is it okay? Is the video okay?
Yeah,
it's kind of frozen on my side, is it?
No, it seems fine to me.
Which the internet facility is so bad. I'm just wondering if I need to.
Yeah, you froze for a second, but then it came back again. I'm not sure if it's your internet connectivity, Sheela, but I think your screen is frozen now. Okay, looks like we lost Sheela Nambiar, the host for the evening. So I guess we'll have to wait. Apologies for that. Meanwhile, does anyone here have any diet related questions? Please feel free to ask. Just put it in the chat and then maybe we can just chat.
Are we talking about different types of I'm Leena from OT. Hi,
yeah, hello,
Dr.
Leena.
Sheela.
Hi.
So now I was just wondering, are you talking about any specific kind of a diet or generally, or like
No.
all these, because so many diets seem to be coming in, paleo, keto and all.
Right.
So a percentage of people find them to be successful and some don't, they fail at it. So is there any specific reason for that? Like why is it like something?
Well, see, the thing is, most of these diets work short term. In fact, there is a a question on that, the latest fad diets. I think she's going to ask a question on that too. And I have a couple of slides on that. I will be talking about it a little later, but let me answer your question.
Okay.
There are a whole lot of diets in the market, so to speak, and a lot of them do work for a short period of time, because basically the way one eats, changes. If one is used to eating, let's say, a high carbohydrate, high fat diet, and moves from that to a low carbohydrate, high protein diet, then so the way one eats is completely different, and probably the total intake also reduces because one is not used to eating that kind of a diet. So when that happens, there is automatically some amount of weight loss. So that is one reason, but then this is a temporary thing. It perhaps will work for maybe some amount of weight loss and some amount of blood sugar control initially, but then what happens in the long run, we don't know, because a body is supposed to be taking, I think Sheela is back. Body is supposed to be taking a certain amount of nutrients, carbs,
Hi.
proteins, fats, all of that. So yeah, hi Sheela, welcome back. I was just talking to Leena.
Hi.
Hi. Leena, if you don't mind, can we just?
Yes, we can go ahead.
I will answer this question. But then what I'm trying to say is it does not work in the long run, and does not work for everybody.
Sure. Thank you.
Put simply, you're welcome. Yeah, we were having a little chat at the back end, Sheela.
Okay. So, what's happened is, I don't know why my computer is not able to log on, Sheela. So, which means I won't be able to. Okay, let me see if I can get it on to your slides I'm talking about. So I've come on through my, through the phone. Mm-hmm. So I may not be able to share your slides. That's the problem.
Okay, let me try my, oh no, I can't share slides.
You won't be able to, yeah. For some reason, the computer is just not, registering the internet connectivity. Anyway, I'll keep trying. If it's possible.
I can just talk extempore without showing slides. That's not a problem.
Okay. So yeah, so then let's just start then, Sheela. My first question to you would be, do you think that people do need the help of a dietitian? Because most people nowadays do go and, see dietitians. So, how do you think it helps, and how long do you think they need to be with the dietitian?
Okay. To answer your first question, 100% yes.
Okay.
I think everybody needs to, in fact, on my slide, I have a little picture which says, you don't have to be a movie star to have a personal dietitian.
Okay.
So anybody can, and everybody can meet a dietitian, especially if you want to eat right, if you want to prevent diseases, or if you want to get well, if you're already ill, or if you have a kind of a chronic problem like type 2 diabetes, or hypertension, or hyperlipidemias, or whatever it is, to get better and to control your parameters, biochemical parameters or clinical parameters or whatever it may be, you would definitely need to meet with a dietitian. And it's although there are there are umpteen number of websites on the net that offer so-called dietary advice with free advice and all of that, but we don't know how authentic or genuine this information is. So while when a person meets a qualified dietitian, the person will be able to assess the patient's history, the lifestyle, the food intake, the nutritional assessment, everything is done. And only then a diet is prescribed, which is tailor-made to that person's requirements. So I think it's very important for everybody who needs help with a meal plan to meet a dietitian and get help. And it has to be a qualified dietitian and not somebody from the internet or, some neighbor or cousin or grandmother or whatever it is.
Right. And Sheela, when you talk about qualified dietitian, what sort of registrations do we have in India? Because, on the net, now you can do a nutrition degree and you can call yourself a nutritionist. So then what kind of degree are we talking about, and how many years does that take?
Yeah, okay. So basically, we have a graduate program in food and nutrition and dietetics. Different universities in India call it by different names, but it's more or less the same. The syllabus remains very similar. I wouldn't say identical, but very similar. So basically, there's a lot of nutrition and dietetics and other related subjects like physiology, anatomy, biochemistry, microbiology, all of food science. All of these subjects also are taught in the undergraduate studies. In the postgraduate studies, it becomes more in-depth. Disease related, preventive nutrition, all of that. So more in-depth studies in the postgraduate level. And after post-graduation, a person can actually sit for what we call a registered dietitian exam, which is run by the Indian Dietetic Association. It is not a government one, but this is run by the Indian Dietetic Association. And a person who has an RD or registered dietitian suffix after the name means that person is definitely a qualified dietitian. But I'm not saying those who without an RD are not qualified. There are a lot of people who are qualified, but have not been able to take the exam for whatever reason. But it's important to have a graduate level and a postgraduate level qualification, in order to practice as a dietitian.
Yeah. And the internet degrees, which are for like 2 weeks and 4 weeks and 3 weeks, I think they're great for self, to understand for oneself.
Absolutely.
If you want to teach yourself, you want to know more about nutrition, they're great. But, to actually do a nutrition degree online and then start advising people, it's a bit dangerous.
I completely agree. Absolutely agree with you, because we are actually treating people for their health, and somebody who's done a 3-week course or a 6-week course or even a 6-month course in whatever that course might contain, and first of all, it's online. There's no practical experience.
Yes.
And there's no laboratory experience, there's no practical experience, nothing. And that person we cannot allow people's health to be placed in those people's hands who have just had an online course and call themselves nutritionists, and they probably know just carbohydrates, proteins and fats, and a little beyond that maybe, but they're not trained to treat people with health problems.
Right.
So I think it's very important not to fall for the internet degrees.
Culture. Yeah. So my second question to you, which is, you get a whole lot of these diets, which come and go, the fads, there was the Atkins, and then you have all this General Motors, and now you have keto, which is, very, very popular. What is your opinion on these diets and fads, Sheela?
In fact, when your computer didn't work for a few minutes, Leena Rajesh, who is here in the audience, she asked me the same question, and we were just chatting about it. So Leena, this answer is for you too. It's a great question, and I'm so glad you brought this up, Sheela, because there are so many kinds of diets. I mean, I think these kind of fad diets have existed from I don't know how many decades. So in fact, probably more than a century. So these diets have existed in various avatars, so to speak, in various forms, and most of them promise a rapid weight loss, a flat stomach, or suppression of appetite, or age loss, or better digestion, or body cleanse, or magic and miracles. So, my question to these diet people who claim that these diets work is, how do you expect a food or a meal plan to work magic or work like a miracle? That is not easy, and it is not possible. So most of these diets, in fact, work temporarily, because the fact is that when you start eating from let's for example from a high carbohydrate high fat diet, you move from that to a high protein and maybe low carbohydrate diet, just to give an example, right? A person is not used to, the B kind of diet, he's used to A kind of diet. Uh, so moving from A to B, the eating pattern, the quantity, everything changes. So there definitely would be a temporary weight loss because probably the calorie intake is less, right? So there would be a temporary weight loss, but there would also be other effects, like moving to a very high protein diet from a normal diet is like overburdening the system with the cholesterol, the saturated fat, and a whole lot of other things which can actually affect the person's health in the long run. So what we say is, so what we say is, don't go with any kind of fad, because we are not genetically tuned to it, A, and B, our body is used to a particular pattern that we follow over a period of time. So while it is important to move to maybe a slightly better meal plan and make it a wholesome, balanced diet, moving completely to a fat diet will definitely not work, definitely not in the long run. Yes, short-term results have been seen, but not in the long run. So there's just a few red flags that I would say when it comes to fat diets. If a diet promises a quick fix, or if the claims are too good to be true, if the diet has drawn simplistic conclusions from a very complex study, or the advice is based on a very simple or single study, or there are fancy marketing dramatic statements just to lure followers, or if there are recommendations to buy products, these are the red flags that one should watch out for and stay away from diets that have all these tall claims. Because when a person goes on a fat diet, there is a loss of lean body mass, that is the muscle mass. There could be nutrient deficiencies, particularly iron, calcium, protein, and all of that. The body basal metabolic rate reduces, the BMR, as we say, that reduces. So the result is probably constipation, hair loss, anemia, fatigue, depression sometimes, and even reduced immunity. They could also be food cravings. These diets are not sustainable in the long run. So in fact, we always see pictures of before and after, but we don't see pictures of after. You know what I mean? What happens after the after is over?
Yes.
I think that's very important. We need to see the after photos also. And fat diets usually become popular because of short-term benefits or celebrity endorsements, because there's a whole lot of celebrities who say that I have tried this diet and I'm doing very well. So, when a celebrity says something like that, everyone tends to follow. So that's the reason fat diets have become very popular. Different kinds of fat diets have become very popular. But I would not, advise anyone to go on a fat diet. It's nothing like eating a healthy, well-balanced diet for long-term health.
Yes. And it's scary also that sometimes even physicians do endorse things like keto. There is a whole keto gang, and then the non-keto, and the keto wars and all of that. It's really frightening.
Yeah.
We do know that the real long-term results haven't come out yet. The jury's not out yet. We know some, detrimental effects, but we don't know all of them. And innumerable number of clients that you speak to, they do say things like, we had constipation.
Right.
And I'm not able to, sometimes I listen to them and wonder, how did you manage? You lost 5 kilos, but you were okay with your constipation? Somehow that doesn't seem, it just doesn't seem, a healthy sign or signal. And I personally, Sheela, I would think that this is really because of a disconnect that we have between ourselves and our connection to our body, where we are willing to disregard these very clear signs and signals that the body is sending us, saying that we are not okay, what we're eating is not okay, and yet we want to go ahead because of this promise of weight loss. The goal of, weight loss.
Yeah, you're so right, because everybody is more bothered about weight than
Yes.
overall health. We need to look at the body and mind holistically rather than just looking at weight and, weight gain and weight loss and weight management and all of that. It's so much more than just weight. I agree, weight is an important parameter, but it's just
Yes.
one of the parameters in the entire circle of health. So I think that's
Absolutely.
important. And these fat diets, most of them don't have any scientific evidence, majority of them. So I think, people just need to meet with a dietitian to understand better.
Yes. Yes. Yeah. So, if Sheela, you have now joined the Indian Society of Lifestyle Medicine, um, something that I'm very excited about because you're on the advisory board, and that really makes a difference. So, what drew you to lifestyle medicine?
Um, okay, I have to go back by, I think, 30 years maybe. Maybe more than 30 years actually. When I first worked with Dr. Hans Deal, he's my mentor. And he's the one who got me interested in lifestyle intervention programs, preventive medicine, and all of that. So I worked as his associate. Dr. Hans Deal, for those of you who don't know, is he's the founder of Coronary Health Improvement Project. Now it used to be called Coronary Health Improvement Program that many years ago, but later on it was changed to Complete Health Improvement Program. And he is also the director of Lifestyle Medicine Institute in Loma Linda, California. So he has practiced and preached and taught people lifestyle intervention programs. He's a clinical professor of preventive medicine. He's an author. He's a prolific speaker. All of that. So
Yeah.
I had the privilege and honor to work with him in 1988 and once again in 1993 in a lifestyle intervention program, where we saw dramatic results in Indian population, where within a month's time the lipid levels came down, the blood glucose levels improved, weight came down, of course, and even serum uric acid levels came down. So people had excellent, the blood pressure also was better controlled. So people had excellent results within a month of changing their lifestyle. Mainly, of course, it was the physical activity and the diet, the meals and the food that they ate. So that is when I got interested in this, and then so I moved from clinical nutrition field. Moved towards preventive nutrition, and I started to consult for corporate companies, employees in companies, because I believe that, like we say, catch them before they fall ill and go to the hospital. So that is where I began my journey. I think so about more than 20 years ago, and I've been in it since then. And of course, thanks to you and your colleagues in ISLM, I got invited to give a talk at the first conference of Indian Society of Lifestyle Medicine 2 years back. I think more than 2 years back.
Bang.
Yeah, so I was there, and that was, I think, the beginning of my entry into ISLM. And again, thanks to you and others, I came onto the advisory board of ISLM, and now I'm a member, and we're colleagues. So it's been a very interesting journey, and I still strongly believe in lifestyle intervention and prevention rather than wait till somebody falls ill and then start giving medications and treatment.
What your, that for those of you who don't know, lifestyle medicine propagates the whole food plant-based diet. So, can you tell us something about the whole food plant-based diet?
Yeah, sure. Basically, the whole food plant-based diet allows whole grains like cereals and nutri-cereals. When I say nutri-cereals, I mean millets. Millets are now called nutri-cereals. And also pulses, dals, vegetables, fruits, what else? Nuts, seeds, all of these which are plant-based and whole, not refined rather. So, and it does not allow refined foods like maida, white rice, sugar, refined oils, and all of those foods are not allowed. So this is the basic concept of whole food plant-based diet. And there are studies to show that uh, following this kind of a diet reduces the risk of several lifestyle related diseases like obesity, coronary artery disease, type 2 diabetes, some types of cancer, and also reduces the inflammation in the body, leading to better health outcomes. And it happens, rather it works much better when it is combined with physical activity, adequate sleep, sunshine, and all of that. And of course, it's not only healthy at the individual level, but also healthy for the environment. And I think very recently, about a year or two ago, the Eat Lancet report came out where they spoke about eating not just for your personal health, but also eating for the health, eating better for the health of the environment and for the planet, the health of the planet. So in many ways, I think this. I'm sorry.
No, there was somebody else talking, and
Oh,
we
okay.
had to mute them. Yeah.
Yeah. Okay. Sorry.
Yeah.
So I think in many ways, the whole food plant-based diet works at the individual level as well as the at the planet level, at the macro level and the micro level. Let me put it that way.
Yeah. And wouldn't you say that if you really, get into it, it's not difficult to follow? Most people think it's extreme, but it's really not difficult to follow, isn't it? And it's while we do recommend no animal products, and at least going somewhere along, moving along the spectrum, where if you are eating a lot of animal products, at least you cut it down to maybe a couple of times a week, and start with slowly eliminating your refined products, your sugars, your oils, etc. So it's not something that you're trying to do drastically, although going all the way would be preferable. But the point is, it's not such a difficult diet plan to follow if you actually think about it. And there are such a huge number of choices, really, when you think about it. It's more about choices than restrictions, wouldn't you say, Sheela?
Absolutely. I think it's following this kind of a diet, I think, is a personal choice. Because in India, there are two ways of looking at it. Probably for those who have eaten meat all their lives and every single day of their life, they will probably find it more difficult to move this to this, whole food plant-based diet. But for most Indians who are primarily vegetarian, moving away from meat is not so difficult. Is my thinking. Moving away from meat is not so difficult. And I think yes, we are seeing a growing number of people turning from meat eaters to vegetarians. And even in our country, when we say people are meat eaters or non-vegetarians, they're not really non-vegetarians in that sense. Like they don't eat meat every single day. Most of them eat just maybe once or twice a week. So they're really not, completely meat eaters. So for those people to give up meat probably is not so difficult. But in India, what we find is giving up dairy is a big challenge for a lot of people. Because they're used to having milk in the tea or coffee. They're used to having a cup of curd or glass of buttermilk after a meal. They're used to a spoon of ghee on their hot chapatis or rice or whatever it may be. So giving up dairy, I think, is the most challenging for them. But rest of it is not so much of a problem. But then again, when we practice as dietitians, we don't force a particular, what should I say, a particular diet on a person, unless that person is willing to follow. Let me take the example of whole food plant-based diet. If a person is not willing to follow this kind of a diet, there's no point in telling that person, no, you have to follow this and this is what is going to work for you. So I think it has to be a gradual transition from whatever he or she is doing, ultimately to reach towards a better diet, a better meal plan, and better health, of course. So I think it has to be a gradual transition. And ultimately, if that person feels more comfortable and feels more energetic and eating that kind of a diet, and he or she will probably take it up on his own.
Absolutely.
Right. So I think it's a gradual process.
Yeah. So meeting them, meeting your client or the patient where they are is actually really more important than trying to force force your whether it's an ideology or a belief system, whatever it is. It would be much, it would benefit both them and you, because there's no point getting into an ethical argument, because
Absolutely.
ethics, there's no doubt about it. It's just about a choice that the individual person makes. And
Right.
without moralizing and making that judgment call, it would be better to just inform them about the health benefits. And somewhere along the way, when they start to feel really good, which they often do, they start to figure out and turn the corner and start more healthy. And like you said, Sheela, while dairy is a huge problem, the other thing that I find really, really interesting is that, considering that most Indians are vegetarian, they don't consume enough vegetables.
Oh yeah, absolutely.
Their vegetable intake is so limited, and usually the vegetable is killed and then resuscitated with some oil and put on your plate. The major part of our meal is the rice, which actually comes to my next question, which is, what do you think is the problem with the Indian diet, if there is a problem?
Well, it's a very tricky question. So I must say that the traditional Indian diets were planned very well. And I'm sure our grandparents and great grandparents did not know the N of nutrition.
Yes.
They had no clue about the science, or they had a great art of cooking, but they probably didn't know the science of it. But they still planned a beautifully balanced meal across India, whichever part of the country we go to. They have beautifully traditionally balanced meal.
Yes.
Worked very well that many centuries or decades ago, because they combined it. First of all, they actually ate whole food, plant-based diets mostly, and even if they did eat meat, it was all natural meat with it was not factory farmed. It was free roaming, and the meat was not pumped with antibiotics and hormones and all of that. So everything was in a very organic fashion. Things were grown and cooked and eaten, and they also had enough physical activity. So the entire lifestyle was great, and the whole thing suited the lifestyle very well. So we can still follow the traditional Indian diets. We only need to make slight adjustments or slight changes in our plates. But because traditionally, I think Indians were used to eating a lot of carbs, because they needed that amount of carbs for the physical energy that they were expending. Right. So they were used to eating heavy carbs and maybe a little extra fat and all of that, uh, and along with some amount of protein, definitely, and fresh fruits and vegetables and all of that they had. And they did use oil and ghee and all of that, which is fantastic. But unfortunately, what has happened now is, without the kind of physical activity that we have had, that our ancestors have had earlier, we continue to be sitting most of the time. I think there's an echo, Sheela. I don't know where I'm getting it.
I think it's from the Facebook.
Oh, sorry. Okay.
I'll just reduce the volume of that. Yeah. Okay.
Thank you.
Yeah.
So,
is it better?
Yeah, it's better. It's reduced. Thank you.
Okay.
So, without the physical activity, we continue to eat a lot of carbohydrates. I mean, our meals are carbohydrate concentrates, and our protein intake is not enough. We are low on fiber because we don't eat, as you rightly said, we don't eat enough vegetables and fruits. And because of all that, fiber content is less, the micronutrient, the vitamins and minerals are less. And on the other hand, we have high fat foods like oily gravies, deep fried foods. Even while cooking, we tend to add a lot of oil. And while eating, we have either ghee or butter added. So the overall fat intake is high. High sugar intake. I mean, India is full of festivals and celebrations and even ceremonies. We have, right from the time a baby is born till the end of life, we have a ceremony for every stage of life. right?
Yeah.
So there are so many things, which is a good thing. I mean, because it improves the social connect with people. So that,
Yeah.
while it is great, it also makes us indulge in high sugar foods every single time. So with the number of festivals and celebrations and ceremonies, we're eating high sugar foods a lot of time. And we also have foods which are high in salt, like pickles and papads, salt biscuits, and we add excess salt while cooking. So these are some of the drawbacks that we see, which probably worked, some of it at least worked well in the past, but not all of it is working with the present sedentary lifestyle. And secondly, we also have access to convenience foods, the highly processed and highly refined foods which did not exist many decades ago. So I think this is where we have kind of gone wrong in some ways. We need to, I'm not saying we shouldn't take any of those, but we need to reduce those, need to reduce some amount of carbohydrates, increase the protein, increase the vegetable and fruit intake, so thereby we will get more fiber. So all of this, if we make a few adjustments to our plate, I think we'll be much better off.
Yeah. And would you say these are the reasons for the current, literally an obesity epidemic that we are facing? On the one hand, we have undernutrition, such an extensive amount of undernutrition. And then on the other hand, we have obesity. Not to say the obese people are well nourished.
Yeah.
They be obese, but they are nutritionally deficient. So would you say this is the reason for it, what you've just explained about the diet?
Yes. I think more than 50% or more than 60% is the dietary contribution towards these problems. I mean, some people even say 80% is contributed to by the diet. So it's not just the overeating or poor food habits. There's also lack of physical activity. There is also inadequate sleep. People tend to eat a lot of unhealthy snacks when they're awake.
Yeah.
When screen time, when we're spending time in front of the screen, which is actually increased now because of the lockdowns and the pandemic and all of that. So spending time in front of the screen, people tend to eat unhealthy snacks. So which means overuse of technology, unmanaged stress, prolonged sitting. We are most of the time we are sitting, and as you know, sitting is now the new smoking, right? So all of this mindless eating, we don't pay attention to what we eat, the quality of food and the quantity of food, we are not paying attention. So I think we need to we need to be more mindful of what's on our plate. We need to pay attention to better quality and definitely reduce the quantity. So yes, I all of these factors I think put together is leading to the overweight and obesity epidemic, which in turn is leading to other health problems in our country.
Yeah. And what are the common deficiencies you see, Sheela, in the patients that you've, in our Indian population, in your clients? Yeah.
Right. So where I used to consult before, it was mostly the corporate companies, employees rather. So I didn't see too many deficiencies in that sense. Yes, the major ones were protein. So when I used to do the nutrition assessment and the dietary intake, the dietary recall and the dietary assessment, I would say that they definitely are low in protein. And definitely low in fiber, and definitely low in micronutrients, and especially iron and calcium. The intake was so poor, in all these important micronutrients. So these are the things, through the dietary recall and through the nutrition assessment itself, we could make out all these things, right? So I didn't really, the employees wouldn't really go for a check in a medical exam or a lab report, or do their blood work or anything like that. But I would try and rectify their food intake, their meal plans, even the meal timings, because they have irregular irregular meal timings, and there is a lot of food wastage, and they have to adjust a lot because of their constant travel, and they're so confused about nutrition labels which come on packaged foods. So all of these things, basically they have a lack of knowledge on food and health.
Yes.
So those are the things that I would try and adjust and, you know, put them on the right track so that moving forward, because all these people in the companies are young employees. So if things are corrected at that time in their lives, they will, you know, move to become healthier people when they are middle-aged or you know, in their senior years. So that's what I did. But then, yeah, it was very obvious that, you know, they did not get enough protein and micronutrients through the diet.
And I think that's one of the reasons most people, almost everyone, needs to see a dietitian to get that basic understanding and knowledge about food, which surprisingly, even as doctors, we don't get. We don't get that education about nutrition. Even when we pass out of medical college, you know, I had to learn it after I passed out. I didn't know I mean, you know, proteins, fats, and micronutrients, but you really don't know, you know, the kind of research that is done in nutrition. You're not cued into that, and it is an education. So I think every lay person, you know, at least a couple of times, go to a dietitian, understand your food, understand your body, understand your deficiencies, and then take it forward from there. You don't have to go from, you see, the other end of the spectrum is people going from dietitian to dietitian, you know, getting these sheets of paper where there, you know, there is a list of what you do eat for breakfast, lunch, and dinner, and then not very happy because they have not lost enough weight in the first 2 months or whatever it is, and moving on to somebody else, thinking that that person has this magic pill, you know, this magic combination of foods which will cause them cause the weight, isn't it? Seen that. So I think again there needs to be a little bit of common sense as well, and a connection with oneself, because you will recognize if the food is doing you good, feeling better, more energetic, more alert, you know, all these things, and you can gauge for yourself. You're doing well. And like you said, not just about weight, right? If you're focused only on the scale, you can pretty much do it yourself by starving and eating self. Don't you think? You don't need a dietitian for that. A dietitian is really to tell you how to get healthier, not just to lose weight. Wouldn't you say?
Absolutely, absolutely true. Because you know, it does not a diet consultation. That's another thing I've seen, that people want to come to you for a diet consultation and finish everything like in 15 minutes and run. So I tell them, so when somebody takes an appointment, I used to tell them, please allow yourself 45 minutes to 60 minutes at least to spend time with the dietitian. Otherwise, we will get nowhere. And, you know, let's not do a half-hearted job. If you're really interested, keep aside an hour and then come to me. Otherwise, don't bother. So it really takes time, because you have to take the medical history, the family history, the diet history, and, you know, the recall and all of that, the food frequency. By the time you finish all that and understand the person's meal intake and food habits, all of that, and plan a meal and explain to the whole thing, it's like an educational program, 1 hour of education. You know, by the time you explain everything, and we do it with the intention of making that person understand, you know, as much as possible, so that he or she does not face too much of a difficulty in following that program.
Yes. And would you say, Sheela, that, I mean, this is what I find, dietary calls, you know, we are notorious for underestimating what we eat and overestimating the energy that we expend. Because when you actually write down, you will be like, oh yeah, I ate, maybe a cup of rice, but it could easily have been 2 to 3 cups of rice.
Absolutely.
You know, you forget that you ate while you passed the dining table, or that sweet that you threw in your mouth. We're just so amazing at forgetting these things. It does time and effort to get that dietary call and education. And I'm sure 1 hour is really not sufficient. They come back and, you know, go through it again, and they have their doubts. So anybody looking to do a diet consult, please, like Sheela says, think about spending. It's a good investment of time to actually sit down and discuss and clarify doubts, and then go back for support, because you don't really remember everything or understand everything at the first sitting. So go back for support. And I think more and more doctors now are willing to, dietitians and doctors are willing to do this. So I think should, lay people should put this to use.
Yeah, absolutely.
I get quite often is about gluten, Sheela. Is that a myth, or is there something to it, the gluten allergy?
Okay, so when we say gluten allergy, there are, let me see, there are four different aspects to gluten. One is, of course, as you know, it's a celiac disease where gluten is a complete 200% no-no, and every form of gluten is a no-no. The second one is a non-gluten, non-celiac gluten sensitivity, which people might actually have, and those people may not be as sensitive to gluten as the celiac disease people. So these are able to tolerate perhaps some amount of gluten once in a while, but not necessarily every single day. And then we have the wheat allergy, where people cannot tolerate wheat at all. And we have the fad of being gluten-free. So,
Yes.
and I think, of course, there are a number of celiac, patients in our country, and we also see an increasing number of NCGS, that is a non-celiac gluten sensitivity people in our country. But a lot of people have jumped into the gluten-free diet, fad diet, I would say. A lot of them have jumped onto that bandwagon. And
Yes.
I think, again, with weight loss in mind. So I think avoiding gluten is become more of a fad than,
Yes.
people actually who have to give up gluten for the right reasons. People are not giving up gluten for the right reasons. They think that they will lose weight if they give up gluten, and that's why they're giving up gluten. So while it is true that there are problems related to gluten, not everybody is, has this problem. And I think it's important to recognize that. And one should meet with, we have dietitians who specialize even in gastrointestinal disorders. So one could meet a dietitian who works in this area to understand better, and then get a proper, diet plan done.
Yeah, yeah. So are those allergy tests, are they quite reliable, Sheela? You do the food allergy tests, which are
right. Yeah, I would think so, because not only the food allergy test, there's also these the genetic tests which are done. A lot of them do that too. So I think they're quite reliable. I know of quite a number of people who have undergone these allergy tests and found out that they do have a problem. They could be sometimes, a false positive, but those are very few and far between. That's in my experience. I don't know if you have a different experience. Maybe Sheela, your patients might have, reacted differently, but they are reliable as far as I know.
What I found is that they come up with a huge number of almost everything. They seem to be allergic to almost everything. So what I do say is do an elimination diet and see if that really does agree with you or not, and then take it from there. And just backtracking a bit, Sheela, you had mentioned some people may have a gluten allergy while others may have a wheat allergy. So is there a difference? Is it
okay,
else?
so when I say wheat allergy, they're probably allergic only to wheat and not other forms of gluten.
I see. Okay.
Yeah, but that's very rare. We don't come across too many wheat allergy. At least I haven't come across anybody for that matter with wheat allergy. But it's there. It's there in the science. So, so they might be allergic to wheat, but not necessarily other forms of gluten. Whereas NCGS and celiac is, of course, all forms of gluten. And yeah.
So, well, we're almost actually running out of time. If there are any questions that anybody needs to ask on the Zoom platform, please do. I'm not able to access the Facebook Live, so I will probably go back there and answer it later. So if anyone on Facebook Live has questions, you can just type it in and I will get to Sheela, and maybe she could also answer a few questions later. I will check with her and answer you. But anyone in Zoom has any questions, please do just post it in the chat box. So diet and nutrition such It's such an interesting subject, Sheela. And like I always say, everybody, because everyone eats, we all feel that we are authorities on nutrition. We all feel that we know a lot about nutrition. And if you speak older the mothers, like my patients and their mothers and grandmothers are always giving them advice. And, because they feel that they know best, and they've had children, and they've know what to eat during their pregnancy and childbirth. And I've had to go through several long arguments and discussions with the mothers and the grandmothers, telling them that it's okay to eat beans, for instance. You see, a common misconception here, especially among they are not the tribes. There is a community here which they normally would eat a lot of. It's a form of a kidney bean. Their normal diets consists of a lot of the kidney beans, but during their immediate post-delivery, they will stop the women from eating any beans because they believe the babies get gas.
Babies get gas.
Yeah,
okay.
So the woman is just given white rice and rasam, which is really so unusual. Yeah, so I would go through endless conversations with the older ladies and the mothers, telling them that the beans are really their only source of protein, because most of them don't eat that much meat. So they need to give the mothers meat, and they definitely need to add vegetables. There are no vegetables. It's just white rice, and rasam has got nothing. It's just water from lentil. So yeah, so these kind of misconceptions do exist. And the misconception of ghee, for instance, there is another community that will insist that the mothers have a lot of ghee post-delivery, because it's good for the joints, it's good for all kinds of things, good for everything to come out from the uterus, whatever is in the uterus to come out, all kinds of things. So, so we got to keep, answering these questions regarding these misconceptions that exist.
Yeah, right. It happens. It happens with us also. There are so many misconceptions about diet, and I mean, it's a very vast topic to talk about now, but we don't have much time. But then, it happens even in diets. People want to, and as you rightly said, in fact, sorry.
Do you have any funny stories? I said any funny misconceptions.
Can't think of any from the top of my head, but no, I can't think of anything just now.
Okay.
But I mean, just to share with you and the viewers, when I finished my post-graduation, people didn't even know what a dietitian does, and who a dietitian is and what she does. It was, we have been called glorified cooks, and we have been called kitchen supervisors, and we've been called a whole lot of things, but a dietitian. That was that many decades ago. But later, dietitians were recognized only for weight loss programs. The minute you go to, you meet people and say, you're a diet, what do you do? I'm a dietitian. Okay, so how do I lose weight? That's the next question. Even today, sometimes it happens, how do I look? So weight loss, people think that dietitians can only handle weight loss and nothing beyond that. But this was some years ago, but I think today the scene is completely different. People are recognizing that, there are qualified dietitians that they can get help from. And dietitians, we even have specialized dietitians. We have renal dietitians, we have gastrointestinal dietitians, we have pediatric dietitians, we have people who work in critical care. We have so many, and we have people who work in the wellness area, preventive nutrition and wellness. So we have so many different kinds of dietitians now, and all of them are doing pretty well, I must say. So I think there is a question here.
What do you think? What would you feed a baby has changed since my mother's generation to now that amazes her? What would...
I didn't quite understand the question.
Did I? What you would feed a baby has changed since my mother's generation to now?
I suppose so, because
Oh, it's just a
just
comment.
a comment. Okay. Thank you. Thank you, Rashi Srivastav. Thank you for that. And I completely agree with you. I think, what a baby is fed now to what a baby was fed maybe 2 generations ago, perhaps is quite different. And it's the exclusive breastfeeding is followed very, very strictly now. And I don't think it was followed that strictly earlier.
No, it wasn't. And I think they can transition to the the processed tinned food, or would it be better for them to transition to cooked food, home cooked food, Sheela, the babies, I mean?
Yeah, so I believe that it's better to transition from breastfeeding to home cooked foods.
Yes.
And for some reason, if that is not sufficient, then it can be supplemented. But if the baby is getting sufficient amount of, if the growth is normal on the right track, and the baby is getting sufficient nutrition, then home cooked food will work great. I mean, we've seen children growing up beautifully without any, any supplemented food. The tinned foods, I mean.
Yeah.
Okay, there's something else.
Yeah. What is your opinion on intermittent fasting?
You want? Do we have time?
Yeah, you can take that, Sheela. Yeah,
okay.
There is time.
Yeah,
just a couple of more minutes, so you can take that.
All right. So my take on intermittent fasting, if it works well without affecting your health, and if you can sustain it, it's fine. But please, for heaven's sake, eat right when you're eating during intermittent fasting, because I know a lot of people who have started on intermittent fasting, who have not been able to sustain, who have fallen out of it. And there are some people who have gone on that and not been able to not improve their way of eating, meaning the quality of food has not, the quality of diet and the quality of food intake has not improved. It's just that they just worried about the quantity of food, right? So instead of eating in, let's say, 16-hour window, they're putting all that quantity within an 8-hour window and trying to finish the same quantity. So how is it going to be different on your health? And if you're eating all refined foods during that 8-hour window, and then you feel hungry later, you're actually trying to control desperately the hunger. There are so many issues with intermittent fasting if it's not done properly. Right. So if you have to, if you like to follow it, if you like to follow intermittent fasting, please do so in the proper way. If you can do that, 8-hour window or 10-hour window or 12-hour window of eating, then in that window, please eat right. Please eat, pay attention to the quality as well as the quantity of food. It's very important. And if you're able to keep yourself, empty stomach or whatever it may be the rest of the time when you're not eating anything, if it works for you, well and good. But if you do have any health issues, maybe maybe hyperacidity, maybe low blood sugar levels or whatever it may be, please meet with, there are so many doctors like Dr. Sheela Nambiar and so many others in this world. So please meet a physician and make sure that you don't have a health issue. And this is not, actually ruining your health instead of benefiting you. You need to make sure of that. So I think it works for some people and they're happy about it, but it doesn't work for everyone.
Yeah. No, I agree. I mean, there's no point eating the same crap in a shorter time. It doesn't really, help, And like you said, I think a lot of people do it just from a weight perspective. And while it does help, if you do it right, it definitely does help with weight, but it also helps with insulin resistance and improving insulin sensitivity. But everything has to be monitored. You can't just do it without guidance. So we are running out of time, Sheela, and I'm really, it was a wonderful chat. So how can people get in touch with you if they need to consult? Where can they reach you? Can they look for you online? You have a website?
Well, they can send me an email, and depending upon what the issue is, I can direct them to the right dietitian.
Okay. Okay. So I will put in the email address into the chat so
Sure.
that any,
Sure.
they can reach you.
Sure.
And
And may I add one more thing?
Yes.
Yeah, they can also watch the Nutrition Nectar programs, because I get, expert dietitians in various fields, and I talk to them about various topics. So they
Yes.
could even watch the Nutrition Nectar programs on YouTube, and perhaps they can get, it'll be easier for them to meet the right dietitian wherever they are.
So it's called Nutrition Nectar, and I'll put a link into that, into the Facebook live as well as here. Yeah, it's called Nutrition. Very excited to be on it. Just a couple of days ago, talking about my garden and all of that.
Thank you, Sheela.
Thank you so much, Sheela. It was lovely, lovely having you. And thank you, everyone, for logging in. We'll see you again soon. And thank you, and have a very good weekend. The rest of it, what's left. Thank you, Sheela.
Thank you so much. Bye-bye.